Thank you for joining us for the Nattokinase Breaking Down Fibrin and Biofilm webinar with Maureen Fontaine. Maureen is a Darkfield or live blood analysis or Darkfield microscopist, a master herbalist, an ontological life coach, and a spiritual intuitive. She's very committed and passionate about the beautiful art form called live blood analysis. And she is in awe of the valuable information that it offers and is very dedicated to making it available to aspiring microscopists and clients so that all can experience the insights and benefits. In addition, a large portion of Maureen's work with clients is diet, detoxification, and lifestyle, as food is medicine and 80% responsible for our healthy or unhealthy states. In addition, she lectures, she writes, she instructs. She is an instructor at the Pacific Rim College, and then she has extensive clinical experience, which is one of the things she'll be sharing today. And a quote that she has that I really quite think is inspirational: "Let's dance with your shadows as you dance with your light, as they are the gift of your humanity." So with that said, I'm going to pass everything over to Maureen. And I'm very excited to get this presentation started tonight. Maureen?
Well, hello, everybody, and welcome. It's truly an honor to do this in collaboration with Biomed Canada. And I will do my very best to do nattokinase justice here during this presentation. So breaking down fibrin and biofilm is a real focus of mine in my practice. So it was absolutely very exciting to be given this opportunity. So if you look at this beautiful photo on the front page here on my title page, you can see that the red blood cells are just enmeshed with fibrin, which is all that webbing that we see. And in there, the little purple pieces are clots that are forming. And we're going to talk about how all that comes together as a community that is actually in service of you. And no matter how far down the rabbit hole we go, all these functions are actually very much in service of us. This is an outline of what I'm going to be talking about. So you can see there, we'll be looking at what fibrin is, discussing what biofilm is and its function, and the polymorphic relationship to biofilm and fibrin. So where did it start, where did it come from? The use of fibrinolytic enzymes. And number 5 is where I'm going to share my passion specifically, which is the Darkfield microscopy, looking at live and dry blood photos to share with you. And I think they're so spectacular. I can never get enough of them. And I've been doing this for 35 years. So it's truly a passion. Number 6, we're going to look at nattokinase and what it is. And it's such an exciting product that I've had experience with over numbers of years. Next, we'll look at the clinical applications that I've had the chance to engage with and how we can use it in our practices. The number 1 question is always, nattokinase versus serrapeptase and what to use. So I'd just like to address that. And then lastly, very warmly welcome your questions and with the assistance of Heather or any other experts on the other side. So moving forward. So the first thing we're going to look at is fibrin. Here's another lovely photo of what it looks like. And it truly is a webbing system that almost suffocates the blood off. And you'll be able to see more examples of that as we go along. And it very much affects our cardiovascular system as well as every other function in the body. So fibrin is basically colloids that have arranged themselves linearly. They make nice little lines in the background that appear like needles or hair on the salon floor. And they're primordial protein substances that organize simply because they can. So in biological medicine, we're always talking about the foundations of pH and detoxification, inflammation, and the immune system. And I really build my practice on those foundations. As we work with each of them, then fibrin, we get it under control and we diminish the opportunity for it to develop and actually take over. It's considered to be a congestive hindrance that primarily affects the circulatory system, and it gets really dense and deep within compromised individuals. And I'll be able to evidence that to you with the pictures as we go along. And the thicker the presentation, the more this condition or the condition of the patient is related to pathology. You can actually watch this grow and develop rapidly on the screen. So actually the quantum leap theory is very applicable here. The behavior of the fibrin and its development establishes and tells us and talks to us about how aggressive or assertive a situation is. So again, how far down the rabbit hole are you? Blood clots come in because they are essentially for healing the wounds, and they show up actually to help heal. And when their job is done, these clots dissolve, and that's in an ideal situation. Fibrin and clots are also an indication of inflammation and liver stress. And the liver stress is very evident, especially with the presentation of fibrin. So let's look at the causal factors. A real focus of mine is pH balance. So all my patients, I work with the pH balance, and I love working with Clio Alcala and the basic powder or tabs. It's foundational to everyone who comes, and also working with Clio Citro and Clio Sanuvis extensively, because that's what helps us get control over what's actually happening, regardless of what else is at play. Next, we look at toxins as being a causal factor. If we have been using antibiotics or medications, we have consumption of alcohol, tobacco, coffee. This all promotes bacterial overgrowth and pleomorphic activity in the blood and in the body. All those things congest the body. So we see congestive patterns, stagnation, dampness are evident, and we can see that in the dry blood samples that I'll share with you. Whenever we have excess dampness in the body or congestion or fibrin, we get the formation of fungus and yeast, bacterial or viral overgrowth. So in other words, we provide them with a very optimal environment. We get in the way of ourselves with our diet. Sugar, wheat, dairy, alcohol, tobacco, allergens, things like nuts, for example. All of these things interfere with our body's ability to digest, and sometimes these particular foods are not foods that are conducive to our constitution, and we see that in Chinese medicine. Those of you that are very well familiar, I have huge respect for Chinese medicine's ability to mitigate stagnation or dampness in the body, and using diet therapy from whatever modality you come from is quintessential to getting better. So 80% is diet, 20% is going to be what we do in and around that. Sounds kind of crazy, but it's true, over and over, proven itself. Whenever there's malabsorption, again, that lends itself to congestion. And this is where we see that enzymes, we have an enzymatic insufficiency. And so we'd like to plump it up with some really powerful enzymes like nattokinase. When fibrin is present, it is a very strong indicator of liver congestion. And in some cases, when we can't resolve fibrin, we see that we have to investigate whether there's any biliary tract congestion. So it's getting deeper and deeper into the systems that support. Again, the bowel and urinary tract issues might be at cause with this presentation. And an Indican test, which measures for putrefaction of protein in the digestive tract, is something that is helpful when troubleshooting. Emotional distress. So once you see what fibrin looks like in the blood, we'll see how emotions affect the biology. It truly looks like an angry system in the blood, and typically the patient is experiencing some irritation or anger, frustrations, or misunderstandings about the meaning of life, like really deep stuff. And that's where those of you that are Rubimed practitioners are likely working with that process. Inflammation. Dr. Prevetiri's book is a really old book that has a place on most Darkfield microscopist shelves. It's a book called Silent Clots, and he was one of the first guys to put something together, and he talks about the types of inflammation. We have acute inflammation and silent. So in other words, there's what you know and what you don't know, and there's what you don't even know you don't know. So the subtle beginnings of platelet aggregation lean you towards heart disease, And that's how I talk to patients, is like, if this is normal health, what we see here is you're leaning in a direction and we want to bring you back to alignment. Everything is in relationship to each other, therefore, it does not occur in a vacuum. There's a reason for everything we see, and there's a behavioral pattern that we're tracking and tracing. Fibrin has a propensity to proliferate if not addressed. So in other words, if it can, it will. Congestion also contributes to inflammation and all kinds of different symptoms that can show up for you. The passageways of elimination must be open in order for drainage to occur. And here is where I do use the application of, the detox kit, for example, because we have to pull stuff off in order for fibrin to calm down and for clot formation to be reduced. So as you can see, I use things very much hand in hand with each other. Biofilm. So biofilm is such a fascination, and more we see it in discussion, especially like at the college level. There are books on biofilm, and it's really quite the study and very, very fascinating. So the biofilm development, stability, and performance is enhanced by the same causal factors found in the development of fibrin. So all of these are cooperative systems that live within us. The biofilm is the key mechanism for persistent or recurrent infection. We're going to explore that. When insufficient digestion persists, microbial colonies are more able to adhere to the matrix of the cell. So anything sticky makes that possible. When the biofilm exists, so does subclinical infection. It persists as long as it is able to within the host environment. And this contributes to that congested pattern that we see. So if people have dampness, stagnation, unresolved issues, we can go back to these concepts. The fibrin, if we bring that in right now, we see that that's going to evidence the level of inflammation that this particular individual is experiencing. And again, tells us how congested that liver in particular is. The more biofilm, the more potential for disease and conditions. And it's essentially an immobilized biomass that can be released when we get into detoxifying the system. A biofilm encapsulates clots to protect them from this microbial invasion or infection of any kind. So it acts as a barrier to avert the microbial upregulation until the white blood cells arrive at the site of injury. I think this is just so brilliant, because it's like everybody waits for everybody else to arrive so that we have a better chance for success. It's very brilliant. So the fibrin or fibrinogen and biofilms, they're cooperative systems that exist within our biology to initiate repair. So remember, this is all going on waiting for those white blood cells to show up. The primary ingredient for the formation of biofilm networks is this fibrin fiber. The biofilms themselves are tethering fibers, and they act as bacterial filters. It's quite interesting. If we go back to this picture, it's a fascinating picture, and you can just actually imagine how that tethers itself within the tissue and within the system, and it embraces the area of injury. This is a lovely quote here. Fibrin can produce both biofilms and fibers, making an integrated clot structure that includes a fibrin film covering the clot, which is also a network of fibers. Biofilm develops in 100% of cases where thrombin accumulates. It's an amazing system. So biofilms grow when thrombin is less concentrated, leading to longer clotting times. In other words, everybody's waiting for each other to catch up, so to keep you out of harm's way. And this allows for an increase in the accumulated surface fibrin while the underlying network or the clot catches up. Biofilm is absolutely in service of preventing bacterial infiltration to the site of injury, and it sticks around for 27 hours to protect you. And in the meantime, the white blood cells have time to show up, and that underlying clot or healing mechanism has the opportunity to fully form. What a beautiful cooperative system. So biofilms are essentially microbial homes, sticky films that impede cellular respiration and affect functional vitality systemically. And all of us go to the dentist, and we are constantly being talked to about dental plaque and getting our teeth cleaned regularly. And this is a primary example of biofilm, or a mass of bacteria that grows in your mouth and upon your teeth. It's acidic, and it contributes to demineralization. Biological medicine is keenly focused on the dental health as the origin of dysbiosis in the body. There's a wonderful book, I don't know if any of you have it, but if you don't, it's one to really get, and it's available through Biomed. It's a brilliant book that makes this connection for you on a really deep level. And in biological dentistry, they actually look at the teeth to determine which organs are out of alignment and need attention. So the microenvironmental changes accelerate the potential for biofilm development. Bacteria love this cooperative environment, and they form biofilms that are essentially self-serving. It's a very assertive process of embedding and interfacing with the host surface. So in other words, they're very, very busy because they have a mission. Biofilms are always acidic and contribute to inflammation, in which case we're going to see the development of more fibrin in response to this predictable infection and congestion. So now you can see how this all merges together. This lovely diagram shows us how we have an underlying layer of collagen that's experienced an injury. We get the superactivated platelets and the thrombin-activated platelets coming in, and then the fibrin intertwines to hold it all together. The biofilm will come in and tether that all to tissue. The brilliance of the body. Here we have, this is a diagram that I have up on a big poster in my office, and this is the polymorphic or pleomorphic life cycle. So why is that important here today? If we start, this goes counterclockwise. So if we start at the top, we have protits in the regulatory section. The protits are barely, they're mostly invisible until they start to get bigger and bigger, until we get to the bottom of the chart, or the 6 o'clock position. That's where we start to see congestion happening. Then we get into the deposition phase, and the deposition phase is where these symprotits and all these undigested matters that we see on the left side are actually starting to congest the body, and we see the introduction of the filler or the fibrin. So everything's getting uncomfortable. I look at the things that we see on the left side as rocks in your shoes. They're going to contribute to an inflammatory response in the body, in which case the filler or the fibrin comes in. From there, we see the development of michettes and all kinds of forms, going right up to the top at just the 1 o'clock, which is the synosite, which is a more pathological formation. The beauty of Darkfield microscopy is we can see how many of these critters are developing, and then we can unwind them and take them back to neutral. That's another brilliance of this art form. And yes, art form, because it's truly a dance in there. When fatty plaque builds up and blocks the flow of blood to the heart, brain, and venous system, the result is atherosclerosis. So if this plaque mobilizes, a clot forms, and this further deprives the delicate tissue of oxygen and sets us up for things like heart attack and stroke. In come fibrinolytic enzymes, which are primary agents of change in cardiovascular disease and thrombolytic therapy. Fibrin clots and the culminant biofilm can be eradicated using food-derived fibrinolytic enzymes, such as those found in natto. Natto is a wonderful addition that was part of a clinic I participated in for a decade, and we saw tremendous benefits, which I will talk about later. Natto comes in and it dissolves clots and protein polymers known as fibrin. These fibrinolytic enzymes are frequently an integral aspect of nutraceutical application for the treatment and the prevention of cardiovascular disease. In my practice, I see so many people that are leaning heavily in that direction, or they have all the precursors to that. So we want to back them out of the corner. So speaking here about dark field microscopy, it is truly magnificent because it finds the in-between spaces. It's both predictive and preventative. So it's the crystal ball. It shows where you are, and it can predict where you're leaning, in which case we know what to do to prevent that heavy lean in a direction or even a slight leaning. It is a true precautionary measure. It's telling us about your potential for disease and gives us a really good idea of which treatments will be applicable. When people see their blood on the screen, they get really excited. They immediately have a relationship, and I could tell you many, many stories about that. I'm basically looking at the behavior of the red and white blood cells, and I want to see also what's in the plasma of the blood, such as fibrin, such as bacteria, etc. And the adjustments are made accordingly. So every single cell is intrinsically programmed and biologically brilliant. This is what healthy blood looks like. Red blood cells are all the little circles. The white globe is a white blood cell. The black in the background is the plasma of the blood. And we're looking for that to be as clear as possible. I'm looking at the size, shape, and forms of the blood cells. Here we see the deposition phase. So this is where the body's not able to digest, and we're getting an accumulation of undigested protein, fat, salts, and sugars that start to affect the way cells behave and perform. So this is a long story in here, but I wanted to show you how your body pulls all of that into a pile. It's being of service to you. And in here are also live platelets, dead platelets, all kinds of cellular exhaust, etc. So this is a big discussion, but I think it's really cool to see how this all pulls together. Now remember, this is kind of like rocks in your shoes. Now we see the fibrin come in, which is spiky, sticky, and very assertive in this case. In this situation, this is someone with cardiovascular disease, and this was rapidly growing at doing those quantum leaps that I spoke of earlier. And this grows as we observe blood under the microscope. We have a true imbalance of the pH, and we have a very congested pattern here. And it becomes more assertive. This picture here tells us that we have extreme discord in the milieu. And when we see fibrin and rouleau together, we must really focus on drainage. But again, everything, we have to go carefully and very mindfully. Going through the 4 pillars of biological medicine as listed on the side there. Quite important. So pH balance alone will help everything to unstick. When I talk to patients about the pH balance, which again is a huge focus of mine, I equate it to if you don't put a dryer sheet in the dryer, if you use those things. But if we have static electricity, we need to balance things out so that everything isn't sticking together like it has a magnetic or an electrical charge that makes that possible. And drainage, once we start moving things along, then this also improves. Clot formation, if you look at the picture on the left, the little dust bunnies, as I call them, in the background, in the plasma of the blood, this is clot formation. Again, all kinds of conditions that will let that way. There might be damage somewhere in the blood, injury somewhere. And it's, again, there's what we know, which is you stubbed your toe, or you took out your arm at a baseball game. And there's also what we don't know that's creating injury, which is the causal factors that we examined earlier. The down on at about the 4 o'clock position, we see a white blood cell that's absolutely blown apart. So this immune system is quite stressed with this situation. On the right, we see a clot, and this is what it looks like. It's sometimes hard to tell what is a clot or a symplast, but either way, this is highly congestive, but this is typically what a clot would look like. And there you can see a white blood cell working fervently to break that up for you. So again, we have such a cooperative system. We call the formation of clots nationalization, or the urge to merge. So like attracts like. And it's very evident. You can actually watch this happen when observing live blood. Here's a really good example of a clot. And clotting or platelet aggregation is necessary to repair damage to blood vessels, skin, mucous membranes, etc. And it's an inherent process that ensures that we don't bleed out in the event of injury. So it's really, really an important function. The fibrin polymers enter on the scene to arrest the bleeding, and when the job is done, they get reabsorbed. The thing is, sometimes they're not reabsorbed, so we need to investigate what is at the foundationally underneath what we're observing. Protoplasts develop. It's another way that the body collects debris. And we see here a crystallization that is actually encased. So I explain it. It's like, this is toxic to your body. Perhaps it's, you know, a combination of all the stickiness in the cells, and then we get the chemicals from the environment or medications or exposures in work environments. That is all collected up, and your body says, whoa, this is really dangerous. We're going to double wrap it. When we're trying to break these things up later, it becomes more difficult because of the comprehensive nature of this presentation. It's a form of crystallization and an inflammatory indicator. The protoplast, remember how I talked about how when we have injury and fibrin and the clot and that whole cycle, because of it, bacteria, fungus, and viruses really love to adhere to these surfaces and to these sites. Here we see congestion, biofilm, and pH imbalance that is helping the proliferation of this bacteria in particular. And this particular bacteria is often seen in bladder infections, kidney infections, more specifically bladder infections. This is self-preservation and bioremediation from the inside. Dry blood, your oxidative stress test or coagulation morphology, is a holographic view of blood crystallization, and it indicates blood benchmarks used for tracking your progress over time. It's absolutely stunning, and I see a lot of artists and musicians in my practice who are quite taken with the presentation of this in particular, because it is totally like art. The fibrin web system is like plant roots, and those are the black lines that you can see kind of weaving themselves through. So that's the connective tissue. Dry blood is a cross-reference for the live blood and indicates the areas of most concern. So what we see here is demineralization. So basically, these are called calcium spokes, and we can see that that we're experiencing competitive inhibition inside. So the metals and the minerals are competing for presence, and the metals typically win out. So there's work to be done on many levels here. This is what cardiovascular disease looks like with Darkfield microscopy. These are pictures that are by Michael Coyle from his course, and these are beautiful pictures. We see the inflammation. You can just see and appreciate the blistering and that inflammatory feel when you look at these pictures. So this would complement what I see in the live blood and be truly the cross-referencing that I need to determine whether this is a situation or not. Chemicals. These toxins appear as dark waves within the sample. Lymphatic congestion is evident, and along the edge you can see the white pushing through. And with the outer edges, we see splayed cells indicating skin issues, the need for vitamin C, amino acids, and sulfur. So again, these are things that will help in a live blood picture, will help mitigate the presence of injury, also the formation of fibrin. And so everything is informing everything. Chemicals themselves contribute to inflammation and the development of fibrin, and they inform the tissues and contribute to that platelet aggregation and clot formation. And once we have liberated these chemicals and toxins, further injury may occur. So in other words, chemicals, as they go into the body, create injury. And when they come out, because they don't morph shape, they cause injury again. So we can actually see as much, if not more, fibrin as we pull chemicals out. So that will be a natural result of the cleansing that we're doing. At least we know what's happening. And acid, when the body and the tissue is bathed in too much acid, you can see in this picture how it's totally made the cellular structure very spongy, and we lose the integrity of the connective tissue. And this is not seen that often, that there would be this spongy presentation. But it's when that does show up, we do have work to do in order to rebuild the body. So this would be a very big part of what this patient needs. Extreme dysbiosis occurs with pH imbalance, the strong and high presentation of fibrin and also of clots. And the black that you see interlaced in the fibrin, the fibrin in the dry blood picture is actually filled with fungus and parasites, so that darker webbing system that appears, and the black deposits are actually the exhaust from bacteria, virus, fungus, etc. In some cases, this is parasitical as well, and not microbial, that's different. But parasitical. So again, depending on the examination with that particular patient. On the right, this is a kind of fun example of different microbes and bacteria that can grow in the blood. It is a vast study, and sometimes I'll sit with a sample over a 24-hour period, checking in from time to time to see what does develop. And that's how opportunistic they are in certain environments. When I see them first up, when I look at the blood, as in this particular patient's case, we really have work to do. So the potential lies within the blood. So let's talk about the application of enzymes such as nattokinase. Nattokinase is traditional Japanese food made from fermented soybeans, and it was a therapeutic folk remedy for cardiovascular disease for over 1,000 years. It's known as vegetable cheese or stinky tofu, and it really does. I've had the occasion to enjoy some. It certainly smells or tastes better than it smells, but very, very stinky it is. Some people say it smells like dirty feet, blue cheese, that it actually has a very mild taste and is somewhat like fried tofu. And it's considered to be a delicacy. The curds themselves contain vitamin K1, which prevents blood from becoming overly thin. So we have some protective mechanisms within the natto itself. Because that's often a question is, oh, if this is supposed to thin my blood, what if it gets too thin? But this has a natural balance within it that's an important aspect of what natto offers. In 1980, a researcher from University of Chicago, Dr. Sumi, he tested, in some reports say 173 foods, other people say, studies say over 200. Regardless, a lot of foods were tested for answers to blood clot dissolution and stroke and heart attack. Natto came out as a major superstar. Very, very exciting. NSKSD, or natural superkinase sprayed dry. That's what those letters mean. Natto is the name of the food derivative. Kinase is an enzyme that catalyzes the transfer of the phosphate group from ATP to a specified molecule. It's always nice to know what all these letters and names mean. So the process. Natto is a result of fermenting cooked soybeans with Bacillus subtilis. So Bacillus subtilis is a rod-shaped bacteria found naturally in soil, and it's also located in our digestive tract. It's a natural fungicide with endospores that allow it to survive in extreme conditions. The fermentation process occurs over 14 to 18 hours at 40 degrees until this white, sticky, stringy, and very stinky substance is formed. NSKSD is an odorless white powder by the end of it, and vitamin K2 is removed. So, nattokinase dissolves and degrades blood clots. It breaks down thrombus or thrombolytic activity, breaks down fibrin and fibrinogen, which are inflammatory markers. It prevents platelet aggregation or blood clot formation, and a natural blood thinner. It improves cardiovascular and arterial health, decreases blood viscosity, improves blood and lymphatic circulation, and it reduces rouleau. Rouleau is when all those red blood cells stick together. It dissolves the matrix of bacterial biofilms and diminishes the potential for infection. It's an effective agent with significant disease, tumors, and cancer. The product that Biomed has to offer us, and it's a huge privilege to be able to use such an excellent product. It's produced by the Japanese Nattokinase Association. It's non-GMO, non-irradiated soybeans in combination with the patented strain of Bacillus subtilis natto. And this is authentic Japanese nattokinase. This is the finest quality available, and it's certified, and it has the highest fibrinolytic units available. And those units are guaranteed, because a lot of times out there, as you well know, we don't always get what they say we'll get. And it's also vitamin K2 free. And again, Biomed has a reputation that has proven itself to me over numbers of years. And to be able to have access to this again, because it was off the market for a while, I'm very excited to be using it again. The product's been tested in combination with heparin in acute stroke victims, and it's also been tested with warfarin, and which is really good, because a lot of patients will come and already be on medications. So we're not here to get rid of medications, but we're here to work cooperatively with that from a natural perspective. The bacteria, the Bacillus subtilis, was tested with mice and demonstrated no evidence of infection, pathology, or toxicity. And again, the K2 has been removed so that we aren't increasing clotting ability as we work with the patient. The things that we need to know about is not to use if somebody has an allergy to soybeans, not to use if you're pregnant or breastfeeding, or taking health products that affect blood coagulation, or if you have a bleeding disorder. Always consult a healthcare practitioner or ask your patients to inform you if they have cardiovascular, kidney, or liver disorders, or if you are taking any medications. If taking blood thinners or being treated for a bleeding disorder, again, make sure that you disclose that you're using nattokinase. If you have surgery, scheduled surgery, please stop using it 7 days before, and always stop immediately if you have something unscheduled. And finally, we're going to look at the clinical applications for fibrinolytic enzyme therapy, or the use of nattokinase specifically. We need to know that enzymes occur naturally in the body, and sometimes we have to help. When things go askew and we're leaning heavily in a direction, having aids such as nattokinase are essential and just incredible. The primary role of these enzymes are to dissolve and digest non-living tissues, such as scars and excess fibrin and any adhesions in the body. And there's very, very little risk in doing so. When nattokinase is orally administered, it lasts in the blood from 8 to 12 hours, which is longer than other things that are injected into the body. Always when we have a treatment plan, we want to layer it with the foundational applications as outlined previously in the slides here, including pH management and diet therapy. So the first thing, biofilm reduction. So in my history, I worked at an alternative cancer clinic, and my focus was 100% cancer. And since then I've worked with many, many other things, but biofilm reduction is huge. the biofilm presence can be what is in the way of healing and repair. So the beauty of using natto is really significant, and natto was foundational to treatment during that 10-year period, and continues to be. Cardiovascular health, we've talked a lot about that. In the practice, we used it for blood pressure. We used it when people had, there was a lot of fibrinolytic activity, a lot of sticky platelets in the blood, sticky blood, blood disorders, all kinds of things like that. Excess iron in the body, it just helps everything to flow better, so damage is not being caused by something like that. So again, we saw improvement with the application of nattokinase. And we get, of course, a cascade effect. The excessive clotting can be caused by an infection or inflammation itself, and we're unwinding basically the effect of these presentations. With diabetes, diabetes and hypertension are often seen together, and especially as the disease progresses. And hypertension is 2 times more frequently in diabetics. Natto comes in with type 1 diabetes and reduces inflammation, and it enhances the immune system response. And if you consider that sugar is like glass in the veins and the arteries, there's a lot of damage done. So fibrin comes in to help with that, and that whole process that we discussed before takes place, and natto mitigates all these processes. Type 2 diabetes, the natto increases our body's ability to dissolve the fibrin and repair that scar tissue. So it's applicable for both. We're improving blood flow rates, which is huge, and natto dissolves the fibrin presence in the blood within the circulation, therefore diminishing potential for clots. So some people in some of the studies refer to it as blood cleansing of sorts. We also get hyperlipidemia, and with the application of natto, we saw lowered plasma triglycerides and cholesterol. And so we're basically improving lipid metabolism. I always overlay that with something like lipidzyme, which is so specific as well. And so we get the overlay. And in some cases, we have to add some other things to deal with the inflammation, depending on how escalated things are. Fibroids and cysts. So fibroids are basically a benign tumor. And we used to get a lot of people with uterine fibroids. These spongy forms are just like a collection of garbage and debris, and the enzymatic therapy was quintessential to dissolving these. So we saw, with the change in the diet, and again those 4 pillars, and the application of nattokinase, we saw tremendous reduction in pain from fibroids, etc. With cysts, which often form in the ovaries and are filled with fluid, the systemic enzymatic therapy, the application of nattokinase was very, very effective, and as was eliminating coffee. So in both these situations, those were things that made a difference. And we use nattokinase when treating people for infertility. Tumors, again, when we have a massive accumulation of debris and abnormal cells, we bring in natto to help break that up. So everything is involved in the formation of a tumor. One tweak we had at the clinic was we would break open the nattokinase, mix it with castor oil and baking soda, and if the tumor was visible, we would kind of make a fencing around that, so it was coming from the outside as well as the inside from the oral application. It was very interesting. We saw the dissipation of a lot of visual presentations. But again, you have, move forward cautiously. Inflammation, all diseases are inflammatory at their core, And by clearing the blood of excess fibrin and clots, healing now is very, very possible. And your body is very anxious to heal. And the last thing is immunomodulation. So we have, again, a concentration of enzymes within our system. And the strength and concentration of these enzymes is directly related to how well we fight disease and prevent infection, repair injured tissues, and have babies. All of this is connected. When working with Natto, we always, and I continue to see improvement in the performance and behavior of the white blood cells. So acid is injury, clots form as a response to injury, fibrin develops, the biofilm comes on over top to tether it in, and so the cycle goes. Nattokinase and the serrapeptase here. These are important comparisons because I get the question all the time. So I present patients with this here, and we see that the nattokinase is a derivative of natto, where serrapeptase is basically an animal product. It's a derivative from the intestines of silkworm. We have a fibrinolytic enzyme called kinase, and we have a proteolytic enzyme called serratia peptidase. I'm not saying that right, but it might be close. The natto, again, we've just been through all that. So that's all listed there as we went through. And serrapeptase comes in for more the pain and the swelling relief, muscle, joint, and tissue issues. It also does a mucus reduction that is especially kind for respiratory conditions, and scar tissue help. And you can see there they share a lot of things in common, and yet they each have a little grandstanding to do of their own. So I'm going to hand this back over to Heather and participate as we go here to answer any questions. Back to you, Heather.
Great, thank you. That was excellent, Maureen. And I know just even from within the Biomed office, I've received all kinds of messages already saying it was so informative and they've learned so much. So thank you on that presentation, both with biofilm and nattokinase and fibrinolytic enzymes, and some of your very excellent blood slides.
Thank you.
Okay, we have a whole host of questions that came rolling in the last 5 minutes. So I thought we'd get started on some of these. Okay, quick question. And this is about the vitamin K2. I'm vitamin K2 deficient and take D3 plus K2 supplement. How will that affect if I take natto supplement since the K2 is removed? So I guess the question is about taking, if you're already taking a supplement with vitamin D3 and vitamin K2 in it, she's asking if she can take natto as well, which I think the answer is absolutely and yes, just take them at different times of the day. Do you have anything to add to that, Maureen?
No, I have people that do exactly what you're saying and are really pleased with the results.
Okay, perfect. And there was another question also from Judy. There's K2 in Boneshare and in the vitamin D3 drops. Should we limit the K2 intake when applying the fibrinolytic enzyme therapy? And so I think the answer is just to be taking them at different times of the day. As an interesting clinical pearl, nattokinase is very effective to take before bed. This is often a time when the stomach is empty because you want to take it on an empty stomach. And often it's taken because it is shown that blood clots and heart attacks and strokes often happen in the night. And so nattokinase, then taking it before bed, and as Maureen mentioned, it stays in the blood for 8 to 12 hours, is then a protector through the night for blood clots and such. Okay. Another question, does nattokinase reduce or remove arterial plaque?
I've certainly found that it does. Because we're doing healing, or we're taking away the factors that are interfering with smooth cell walls, the vascular, the lining of the veins and arteries. So all of that falls away. Because we have lower cholesterol, etc., everything improves. I'm kind of getting tangled in my answer, but Heather, maybe you can pick that up.
Mm-hmm. Yeah, I mean, definitely arterial plaques are often formed as like the Band-Aid for damage to internal blood vessels. And so it's kind of a patching up. And then if there's excess calcium and other things, it can also get caught in that. And so by cleaning up the blood and allowing things to flow better, naturally the plaques can start to break down. One thing, I don't think I would rely on nattokinase all by itself in a scenario like this. Our product, tocopherol, has actually been shown to help remove plaques out of the arteries. And so tocopherol plus nattokinase is a really good combination for that. Also, you could use the MK7, which is the vitamin K2 plus D3 drops at a different time, because the MK7 is also known to take the calcium from the blood, and then the D3 helps to bind it into the bone matrix. So doing a combination of nattokinase plus tocopherol and then the MK7 D3 drops at a different time of the day can be a really effective way at working to break down and clear the over time, and it's over quite a bit of time, to remove those arterial plaques. Okay, another question. Here we go. If somebody is taking heparin or warfarin or blood thinners, it's safe to use generally. Is it safe to use generally?
The study that I looked at with nattokinase, they were measured against warfarin and heparin. So the studies say that they are compatible.
Mm-hmm. Again, it is a caution on the label.
Yeah.
A caution and warning. However, monitoring is also important as well.
Mm-hmm. Yeah, it's a product that is to be greatly respected, of course.
Mm-hmm. And then kind of with that, this question may have already been, there's a few that came through like this. Have you used nattokinase in your practice when people are on blood thinners or are other cardiovascular or CVD-related medications? And what were your results?
Yes, most people that would come into the clinic or that come in to see me now may be on blood thinners. What I've done is, because the blood says that we still have work to do, even though they're on these things, and we have to break down the fibrin, and still the clotting potential is there. So what I have done is I'll do every second day, just to make sure it's a slow and very monitored process. But again, these people typically are also having their blood checked all the time. And when it's being checked all the time, then we can just proceed very, very cautiously.
Mm-hmm.
Yeah, and I think that they got improvement for sure.
Perfect. And that essentially answers this other question. Do we need to monitor coagulation profile in cardiovascular disease?
My response to that is I have the blood to lead and to tell me how things are going. If you don't have that, then by all means, I would suggest that they get monitored or have some monitoring system available. I'm always more comfortable with that personally.
Mm-hmm. Good advice. Okay. A question regarding the clinical applications that you mentioned, the 7, I believe it was 7 points. The practitioner, she's asking if there's research to support these different clinical applications.
Certainly I can evidence in blood the changes, the improvements over time. That is there. There are many, many clinical studies that I researched in the making of this webinar, and you can see some of the sources at the end of this. Again, there were just so many. Probably for all of there are clinical studies for everything except the castor oil, which was simply people experimenting and us experimenting, and people coming back with their anecdotal reports, which is like very exciting. And there was no harm done in doing topical applications. So the studies, if you go, when we're all done here, maybe I'll flip to that page now. But these are some of the studies that I cited in making of this. And so my answer to all of that would be yes, except for the castor oil baking soda nattokinase mixture. So that is not anything that I have found. It was the anecdotal.
Okay, and then talking about the castor oil mixture,
yes.
We have a question. So for tumors, you would mix castor oil and turmeric, and she says, and do what with it exactly?
Oh, okay. So I would open, this is based on Edgar Casey's, one of his treatments. So making a salve or a thick paste of castor oil and baking soda, and then opening up a nattokinase, 1 or 2 nattokinase capsules, depending, again, one, if it's only maybe a loony size amount of paste you're making, depends again. But apply that in and around the tumor, not on the tumor. I guess you could put turmeric. You can get really fancy with these things, but I like things to be simple, and then we can monitor what's doing what. But we did see that the visible tumors in one patient who had one on the top of her head, we saw that shrink over time very beautifully. She had shaved her head so that she could continue to come in and show us. It's very brilliant, and that mixture also works on things like warts and moles and such things. So again, this is back to Edgar Casey. All I've done is add the nattokinase in there.
That's some nice advice, especially with the moles and kind of spots on the skin, to have something to be able to do some topical application with.
Absolutely. Yeah, it was everyone loved it and got great success with it.
Excellent. Okay, we've got many more questions here, some really good ones. Okay, so with a client with a very high D dimer, 3 times of the normal range in her lab report, but further investigation on her veins show no blood clots. However, that I'm not quite sure if I actually know what the question is in there. It might be just as nattokinase, maybe something to consider.
I don't know that. I don't have an answer for that one.
Okay. Nattokinase. Okay, so Judy, we can get back to you about that or maybe look into it a little bit further for you. Okay, and this is a good question because this comes into the whole safety part, and one of the things to be very cognizant with nattokinase. Does nattokinase or can nattokinase cause blood hemorrhaging if taken for a long time or at higher dosing?
The way that I can speak to the way that we used it and continue to use it is that once the problem has been rectified and we know that we've changed the behavior of the blood, then we can let it go and just know that it worked and then come back to it if the situation perpetuates. In the studies, my understanding of the studies is that certainly in Japan it's used as a preventative for cardiovascular disease in people that are like 50 years and up. So there were no contraindications for using it as a daily application in the studies that I reviewed.
The one thing with nattokinase, with the bottle label directions, it's 1 capsule once a day. So the dosing is not very high. And then there's certain clinical applications to consider dosing higher. However, in that case, then just monitoring physical symptoms on the client or patient, if they find that they're bruising easily, or if they by chance happen to cut themselves and it seems like it's taking a long time to clot, or maybe if they're noticing nosebleeds, then those are times to either stop nattokinase completely or back off what the dosing is. And so as far as hemorrhaging, as far as I understand, if you're following label directions, then it should be fine. And then, Maureen, that's amazing advice just regarding like length of time. It's not something that needs to be taken for years and years, but can be pulsed. Take it for some time, take a break, and then come back and take it for some time as well. Okay, next question. Oh, sorry, go on.
I can just add one more thing to that. I find in my older patients that it's a real safety net for them. Like sometimes they start feeling like they're getting congested, and that their heart isn't functioning optimally, and so they'll take Natto for a while, and then just kind of get things aligned again, and they get better because when you get better blood flow, you get better oxygenation, which means their brain functions better. They have more energy to do the things they do. So it's been quite beautiful to watch how they watch their relationship with it. So.
Okay, we've got two questions here about nattokinase with other products for safety, and one is with self-tonic, and then one was aspirin. So what I can definitely say with nattokinase and self-tonic, absolutely you can give those two products together very, very safely. There's no contraindications taking them at the same time or taking them on the same day. And then Maureen, what is your advice about a patient, can we give nattokinase to a patient with aspirin with cardiovascular disease?
Well, again, if somebody has cardiovascular disease, they're going to be monitored medically or not through their naturopath. I'm a big fan of if we're going to combine things like that, that we should have some monitoring system in place. That being said, the studies have me feeling quite confident that that would be compatible, because there's not, an aspirin is not, that doesn't have that much blood thinning ability, yet they would participate well together. So wouldn't be too afraid of it, but I would personally keep an eye on it. And back to what you said about watch if you're bruising or things like that. The aspirin itself is, from my understanding, isn't going to break down fibrin, and so that would be where Natto is the winner there. It's aspirin. Well, I'll speak to Natto. Natto is going to make sure that things flow and we take care of the environment. So that would be, I would see that it would have a much bigger effect and be able to foundationally change things.
Yeah, because fundamentally that's what it's all about, is it's about getting to root cause and really changing things so the body regulates better on its own.
Precisely. So with aspirin, we're not really changing the environment to the degree. Like, we want to get really into what's causing the problem in the first place.
Okay, so this has already been mentioned, but I'm just going to say it again. So Kathy's asking what time is best to take nattokinase. Is nighttime all right? Absolutely. You could take it at any point you have an empty stomach, but nighttime is a really good time to take it, or first thing in the morning. And so, Kathy, the other part with an empty stomach, yes, whenever you're taking any sort of proteolytic or systemic enzyme or fibrinolytic enzyme, it's better to take it on an empty stomach so it's not interfering with digestion. And then, Maureen, another question to the same arena is it's recommended to take with an empty stomach. What about clients who have stomach ulcers or sensitive stomachs? Do you have any experience with that?
I do. No one had trouble that I've ever worked with when they had a sensitive stomach. There were no contraindications that way, or no indications that it was creating damage. In fact, because it helps eliminate or diminish inflammation, it actually was quite user friendly.
Excellent. Okay. So another question from Marcel, and so the first thing she says is thank you to the presenter. This is a very good webinar. So I've been getting great feedback in here. And her question is, it says to do not use of liver disease, and if you could explain why it's not recommended to use it, nattokinase or the NSKSD, if you know.
What I do know is that presentation of fibrin in blood is a representative of liver stress from my perspective and my training. So whenever we see that, we know that the liver is really, really stressing. And in liver disease, that fibrin that you saw in the pictures is like quadrupled. In my mind, it comes down to when we start to liberate things and break things down, if the passageways of elimination aren't open, we have a problem. And if the body's immune system isn't up to par, as we see sometimes in disease, under-functioning or over-functioning immune system, then we're going to put the body or the patient into stress. And, so again, we need to be very vigilant with people that have extremely compromised situations, such as liver disease.
Exactly, and it is it is on the label as per Health Canada, and so it's one of the things that is something to be considerate of. Okay, so this is a clarification question about excess iron in the body. So nattokinase could be good for someone with hemochromatosis.
Where natto is good is to come in to repair the damage. Because if there's injury from excess iron, because excess iron truly does create inflammation and damage tissue, we get the biofilm showing up, we get the fibrin showing up, we get excess clot formation. So then the natto mitigates all of those processes that we talked about in this. So it's improving blood flow, because in people that have hemochromatosis, we see that the blood is super sticky. Even when I access their capillary blood onto the slide, it's sticky like jam, and that's really concerning, and that will cause vascular damage for sure. And then that helps with the healing, the flow of the blood, and the flow of the blood, essentially. When the blood is flowing, we have less opportunity for infection. So I do apply natto in these cases.
Excellent. Okay, so just through the questions that are still coming through and that we're working through, there's quite a few questions in here about how long to take it or take nattokinase, but I think that you did, do a good explanation about taking it kind of for as long as it's needed. The second part of that question, if you're not looking at the blood, how do you know if it's working or if it's worked?
That's a great question, because not everybody has this access, of course. Back to what I mentioned earlier is that we see higher oxygenation, so the brains are working better, they get more energy, and they feel less encumbered. And one patient recently said she just feels lighter, and she said she hadn't lost a pound, but she feels lighter, and it's almost like light coming into the body. You can see the change. So discussing energy, brain function, how they're sleeping, all the standard things that we look for, and essentially you do see a lifted spirit in those individuals. If you consider that fibrin, anything congestive, we're going back to, the emotional imprint of fibrin, for example, is that anger, frustration, confusion, just not having clear focus in life and being a bit cranky about it. And they come back, and there's more peace within them. It turns into a very lovely conversation with the patient. But I would look primarily at, it's like there's more breath inside. These are words that the patients share with me. And that's before we even look at the blood, because I like to sit with them and chat about how, their experience since they were in last. So, I would bring it down to those things. Sometimes they come with, their lab results from the doctor, and we can see some nice changes there, and see any previously compromised numbers shift and change in a positive way.
Mm-hmm. One of the other things I know for things to look at and feedback that I've got from patients and from other practitioners, because nattokinase is actually very effective in concussions, with concussions laying that fibrin network to heal. And so it can actually heal up or help speed up the healing process during concussions. And so I know I personally had a patient with that, and within a week she said that she felt substantially better and started to heal much quicker when she started nattokinase. So that's one arena to be, so coming back to the brain, this would be in concussion situation, but still better kind of brain and feeling better there. And then for women that you're using nattokinase for fibrous tissue in the body, especially for excess fibrous tissue in the breasts, you can actually notice a substantial change in breast tissue and kind of releasing some of that fibrous or fibroidy type feel to it. And so some of the actual physical symptoms in the body, you can start to see things and feel things changing. And with scars, visible scars, sometimes you can also see those scars starting to break down and getting kind of better repair of that tissue, so, better blood flow and less interference fields and such.
And that's where that, application of that topical application is great too. I forgot about that. Is on scars, because it will stop scars so that they're not, especially big scars, right? You can see how the tissue hardens and it softens it. So that's another way to use it.
Excellent. This is just a clarification. So serrapeptase is used for joint issues and nattokinase is for fibrin issues. That's a good way to summarize the two. Serrapeptase, as a proteolytic enzyme, breaks down protein and inflammation, so it's very associated with joint and tissue and muscles. That's not the only thing it does, but that's a big arena for it. And nattokinase, because of the fibrin, tends to be more about cardiovascular and for fibrous tissue in the body. And I'll make sure that the slides are all going out within the webinar, with the webinar follow-up email, and so you'll have all of these, and you'll have that page that Maureen put together with the nattokinase versus the serrapeptase to know the differences between the two. Okay, there's a few more questions here, so we'll just move through the rest of these. How long after surgery can one take nattokinase?
Typically, we would wait a week to 10 days. If it was a really major surgery, like heart valve replacement, because they're on such heavy medications, we wait longer until they have some strength and have landed well on the other side of it. So it's a judgment call depending on the situation.
All right.
And then regular surgery, 7 to 10 days, I would say.
Yeah, 7 to 10 days. I think that's a fair thing. And same with serrapeptase if you're using that to heal scars as well. The serrapeptase and nattokinase, there's a question about taking them both together. Yeah, absolutely. You can definitely do that. You can take them both together at the same time. You could take them at different times of the day. And they're working differently in the body, but also, really helping to break down any kind of inflammation and fibrin together. Okay, so it looks like there's just a couple more here. Can we add fresh herbs to increase the effectiveness of nattokinase for bacterial infections in the lining of the arteries, like you show on slide 32?
I better go back and look.
That's your picture of the artery that looks like it's got some buildup. So one more back. So
the question is, again, can we use herbs?
Herbs, yeah, to increase the effectiveness of nattokinase for breaking down bacteria and inflammation.
Oh, absolutely. Everything, sometimes you can just apply one thing. It's all of it. I freely use herbs and food therapy and homeopathy all together, depending on, the patient and the situation. Absolutely. Yes. And it would depend, of course, on which herbs, that's another discussion, but Yeah, for the most part, yes.
Okay, I think that this question might be a little bit outside of today's presentation, and it's about omega-3s and increasing bleeding within the body. I think ultimately with fish oils and omega-3s and also with some of the things like nattokinase and serrapeptase and systemic enzymes, we always have to be cautious with people who are on blood thinners. Typically, if you're following dosage direction, they will not cause bleeding problems on their own, but if somebody's on a blood thinner, then there are definitely cautions, warnings, contraindications on the label, and that's where you just need to be really careful. Okay, and then a question about patients taking statins. And the question's around statins because they now believe statins have an effect to stabilize plaque, whereas we are talking here about breaking them down. Are there any concerns about these opposing mechanisms that you're aware of?
I would have to do some research to answer that. I don't know if you know something about that.
No, I don't know enough about it. So, I mean, I think it comes back to the answer that you gave just a few minutes ago about the terrain and about the matrix and about cleaning up the fibrin in the blood. And so therefore, if there is the opportunity for the blood vessels to be cleaning up because of that, or at least not kind of building things up further, then nattokinase definitely has an advantage there, and it wouldn't necessarily destabilize a plaque, but maybe have the opportunity to help start to let it break down slowly and very carefully so that it is cleaning up the internal parts of the arteries and veins. Okay, one more compliment I have to give. Thank you for the very nice photos of dried blood. The pictures are very excellent. This comes from another Darkfield practitioner.
Thank you.
Okay, so I've got two more questions, and then we're going to call it an evening. So would it be advantageous to use nattokinase with someone who is on chemotherapy? If, again, you're aware of that.
Yeah, we used to use it together or during the same time period, depending on the immune system of the patient. If the patient is, we know that nattokinase can improve the immune response, but if the patient is too compromised from chemotherapy, then it's not the time. Again, just like after surgery or something, we wait until there's a level of health, so that we're not asking the body to do too much. And people that are on chemotherapy, medically, they're looking to diminish diminish the functioning of the immune system, and this would actually bring it up. So it's seldom an acceptable complementary treatment to the medical. So it becomes, when people are really immersed in the medical model, such as with cancer, I personally tread very cautiously and am respectful of that. Yeah.
Yeah.
Answer the question, but there's a pecking order that shows up.
Good advice. And last question, for uterine fibroids, how to administer fibrinolytic therapy and for how long for usage, and do you need to take a break in between the therapy?
What I do with this situation is I use two enzymes. I use clearazyme and I use nattokinase, and that together with some other things and really working on detoxifying the patient, we get some really nice results. It takes a lot of time. So I always tell people that we're looking at 3 months minimally to break this, the fibroid down or fibroids. We have to change the whole environment inside, but in the meantime, we can work at dissolving the mass, and it takes a lot of diet therapy as well, but putting the clearazyme and the natto together is really brilliant. and health workers as
Excellent.
well.
And this also comes from another Darkfield microscopist. So I know we've had quite a few of them tonight that have joined in for the presentation. So with that said, there's been some pretty intense questions here and very good ones. So Maureen, thanks for answering all of them. I'm sure that's going to be very helpful for practitioners to have some better understanding about using nattokinase clinically, especially for fibrinolytic therapies. And so thank you everyone for joining tonight. Thank you so much, Maureen, for presenting on fibrolytic enzymes and biofilm, and then how to use nattokinase as a fibrolytic enzyme to help in clinical practice. It's been such a pleasure.
Thank you. It was a pleasure for me as well.
So thanks, everyone.